The STA system allows you to perform the new STA intraligamentary injection, which is significantly different than a traditional PDL performed with either a dental syringe or high-pressure syringe. The traditional PDL delivers a low volume of anesthetic under high pressure. In contrast, the STA intraligamentary injection can deliver a larger volume under minimal pressure and thus provides a comfortable injection with profound anesthesia and longer duration. The dynamic pressure sensing technology designed in the STA system allows you to have continuous real-time pressure sensing feedback during the injection. The STA system will assist you in finding the optimal injection site to place your needle by offering audio and visual confirmation. It will also maintain controlled pressures below the patient's pain threshold. Let's discuss how to begin.
Injection technique. STA intraligamentary PDL injection. Verify that the STA system instrument is set to the STA mode. This injection is performed using the 30-gauge 1/2 bonded STA wand handpiece. When performing the STA intraligamentary injection on multi-rooted mandibular molars, it's recommended that 2 sites be used. Always start the injection on the distal lingual root of the mandibular molar, followed by the mesial lingual root. The injection can be performed anywhere from the lingual line angle to the interproximal contact for each root of mandibular molars. For the maxillary molars, it's recommended that you initiate the injection from the distal buccal root, followed by the mesial buccal root. The injection can be performed anywhere from the line angle to the interproximal contact area of this tooth. When performing an STA intraligamentary injection on a single rooted tooth, a single site is all that is usually necessary. Using multiple injection sites on premolars or other anterior teeth is optional. To improve accessibility in difficult areas, shorten the STA handpiece by breaking off a section of the handle. This will assist for easier access. In many situations, it's desirable to bend the needle for proper needle placement. The needle should not be bent more than 45 degrees. The needle should be bent towards the bevel. This will allow easier access to the distal root of mandibular molars. The needle bevel should face the root surface during needle entry into the sulcus. While holding the handpiece with a pen-like grasp, approach the tooth at 45 degrees with the bevel towards the tooth. It's important to have direct vision of the needle entry into the sulcus at all times. Place the needle very slowly into the gingival sulcus as if it was a periodontal probe, while simultaneously initiating the control flow rate. The control flow rate can be initiated by depressing the foot control, and after 3 audible beeps, you will hear the unit announce cruise. Once you hear the word cruise spoken, you may remove your foot. The STA system will continue the flow of anesthetic solution. Advance the needle forward slowly into the sulcus. Move the needle gently down into the sulcus until you reach resistance. Maintain approximately a 45-degree angle while holding the needle in place with light hand pressure. Do not use excessive hand force on the needle, as this may block and clog the flow of anesthetic solution from the needle. Carefully control and stabilize needle movements using a finger rest. Once you feel you are at the base of the sulcus, you need to minimize movement for 10 to 15 seconds as the dynamic pressure sensing technology starts to analyze your position. The visual pressure sensing scale is comprised of a series of orange, yellow, and green LED lights. As the STA system senses pressure building, you will see the sequential illumination of LED lights on the front of the unit. If after 20 to 30 seconds pressure does not build, you will need to relocate the needle. The STA system also provides audible pressure feedback with a series of 3 ascending tones, indicating that the system is detecting the pressure at the needle tip. After 20 to 30 seconds with the needle located in the correct location, you will hear the STA system announce
PDL, PDL
the first time it is identified. This is then followed by a series of 2 longer beeps, indicating that the proper pressure is being maintained. After the initial identification of the PDL for a given injection, you will hear only the series of 2 longer beeps when you next identify the PDL for that injection. Insert the needle on the mesial root of the molar, ensuring there is a 45-degree angle of the needle to the root surface. Take care to insert the needle with the bevel facing the root. Very slowly advance the needle all the way into the sulcus until resistance is felt. The STA system will once again begin to determine proper location by the dynamic pressure sensing. It's important to be aware that you may achieve success while in the high yellow zone. The high yellow LED zone indicates that you have a high probability of being at the correct location to perform the STA intraligamentary injection. It's necessary to maintain the LED light indicators throughout the injection process to achieve success. Note that you'll not hear the audible spoken word PDL in the yellow zone. A successful STA intraligamentary injection can occur in either the green or high yellow LED zones, as both are indicative of the correct location. To determine the amount of anesthetic solution dispensed, you can view the vertical green LED volume gauge in the upper left corner of the STA unit. As the green LED lights descend, you will hear a corresponding tone at each quarter cartridge. When you've delivered the required dosage, you can remove the needle. To avoid anesthetic solution spray back into your patient's mouth, perform the following. While the needle is still embedded in the patient's tissues, depress and release the foot control pedal. Count 3 beeps after releasing the foot control, and then totally remove needle from patient's mouth. Direct the needle away from patient, as a small amount of anesthetic solution may still be present. There are 3 primary reasons for postoperative complications from the PDL injection. These are: first, the PDL ligament tissue can be traumatized by mechanical injury from needle manipulations. It's important not to use excessive hand force when placing the needles into the PDL space. Wedging or forcing the needle into the PDL space can cause postoperative discomfort. The second general reason for post-complication may be as follows. It may be the result of delivering an improper amount of anesthetic solution resulting in excessive fluid volume in the area of the dental papilla or periodontal ligament, causing tissue damage. The third general reason for post-complication may be related to the improper selection of the dental anesthetic solution used while performing the intraligamentary PDL injection. Please refer to an appropriate reference source for guidance and recommendation pertaining to local anesthetic solutions and specific volumes for each injection. It's the sole responsibility of each practitioner to identify, select, and administer the proper drug and volume for a given patient. The following information serves as a suggestion and is not meant as definitive guidelines for any specific patient. The suggested drug and volume for performing the STA intraligamentary injection is 2% lidocaine HCl, 1 to 100,000 epinephrine. A drug volume of 1/2 cartridge or 0.9 milliliters is suggested for a single-rooted tooth. For a multi-rooted tooth, 1/2 cartridge or 0.9 milliliters of anesthetic for each root is indicated, thus resulting in a combined total of 1.8 milliliters of anesthetic for a multi-root tooth. Untoward reactions have been reported when using 4% concentrated local anesthetics. If you elect to use a 4% concentrated local anesthetic drug, such as 4% articaine HCl, use 1/2 the dosage previously suggested and use caution when using these medications. Please refer to an appropriate textbook reference source for guidance and recommendation pertaining to local anesthetic solutions and specific volumes.
The STA intraligamentary injection is virtually painless and is ideal for single-tooth anesthesia in either the maxillary or mandibular arch, providing profound anesthesia without collateral anesthesia to the face, lips, or tongue for procedures of less than 1 hour.
It is important to realize that the STA intraligamentary PDL injection can now be used as your primary injection instead of the mandibular block injection when treating single teeth in the mandible. The PDL with the STA system is more predictable than performing the mandibular block injection. It has the following benefits for you and your patients. First, it saves you time by giving instant onset of anesthesia. You no longer have to wait 5 to 10 minutes to find out if your block injection was successful or not. Secondly, it allows you to do bilateral dentistry in a single appointment. You no longer have to make your patients come back for a second time if they need treatment in both lower quadrants. And lastly, it eliminates collateral numbness of the lip, face, and tongue, and it does all this painlessly. The STA system will make your practice more efficient and more productive.